Next, we'll go to Carly in Brooklyn. Well, Carly, thanks for staying online. What's your question?
Hi, thank you for having this town hall. I am an OBGYN practicing in Madison. I've also practiced in rural Wisconsin. And I wonder how we are so focused on talking about reducing deficits and so focused on talking about reducing Medicaid spending when we are also expanding massive tax cuts. Because you sit here and talk about how my patients, my Medicaid patients who need my care are, just using the system for their care, when in reality what will happen when you take Medicaid funding away is those people will show up in crisis and all of us will still end up paying, only we'll pay more and more of the hospitals will close and there will be less people and less resources available for all of the other people who are also paying for it.
So Carly, first of all, I'll ask you, did you want a tax increase? Because had we allowed the Tax Cut and Jobs Act to expire, there would have been a $4 trillion tax increase on virtually every American that pays taxes, because we cut them for virtually every American, as much as Democrats lied about that back in 2017. So again, I wanted to prevent a massive automatic tax increase.
I actually don't mind if somebody is spending my money on something that actually helps my fellow Americans. But right now, what I feel like is happening is we're just stripping it away from the people that need it and giving it to people who have massive amounts of money already.
Okay, well, Carly, we went from $4.4 trillion to over $7 trillion in 6 years. We are wasting all kinds of money, and that's one of the reasons I want to do this audit. But again, let's just go back to Medicaid and talk about the Obamacare addition to it. I don't know that you are aware, but for a single, childless, working age, able-bodied adult, for every dollar the state spends on that Medicaid patient, the federal government kicks in $9. For every disabled child, probably the people you're taking care of, for every dollar the state kicks in, the federal government puts in $1.33. That's the way Medicaid was designed. The states were going to administer the program, but they had to have significant skin in the game so they would actually control eligibility, try and control costs. Obamacare was a Democrat scheme to move to a single-payer system, so they incentivized states to sign up single adults. Rather than incentivizing childless, single, able-bodied, working-age adults to go get a job and get health care through there, they incentivize them to come on to a government-run health care and actually incentivize them not to work. And a lot of them take them up on that offer, combined with food stamps and all the other support we give to people who don't work. I just think the best, most humane thing to do is encourage people to work, help them find jobs. But again, I think it's just grotesque that we literally pay $9 for every dollar the state spends on a single able-bodied adult and only $1.33 for every dollar we spend on a disabled child. I mean, it's bizarre, okay? And it's led to provider taxes, provider fees, which are not health care, driving up the cost of Medicaid by hundreds of billions of dollars that we can't afford, that we're mortgaging our children's future to fund. So we just have a basic disagreement. But Carly, thanks for working health care. Truly do appreciate that.